Right. So, do you guys know, hundreds of millions of kids talk to, AI about their, suicide every week? Is, kind of, this is the, problem we want to solve. So we use, general devices like your smartphone, tablets, PC, laptop, these things. No special devices like, even smartwatches. We don't use them because, just get a handful of kids used it. So we developed the sensor technologies to detect, mental health conditions in everyday context out of, hospitals. So that they can, they don't need to go to clinics. Okay? So you guys know, the youth mental health is really serious, especially after COVID-19 is a disaster across the whole world. A more serious problem, mental health professionals just rare, right? In Korea, there was a news article about a couple years ago. It takes about, 7 years to meet, you have to wait to meet with, a child psychiatrist. In the UK, it's a lot more serious, right? So in the US, it's a kind of a kids mental health. It's kind of a national emergency, right? Because the the problem is not just kind of a, the shortage of, mental health doctors. The real problem is kind of the way of understanding, diagnosing, kids' mental health problems. 'Cause if your kids are younger, you cannot even ask, fill out the questionnaires, right? You cannot even ask questions. Their parents should answer. If their parents is gonna, have jobs outside, right? They don't know, right? This is kind of the practice we really want to solve, right? So this kind of a traditional mental health assessment, there are like observations, self-report questionnaire, or parent report, is quite late to catch problems. So as concerned the parents about this kind of a current practice in psychiatry, especially in child psychiatry, we started this company, 3R Innovation, as a spin-off of AI Institute of Seoul National University about 4.5 4.5 years ago, where we detect in the mental health kind of a signals, the early signals, right? So that before the mental health decline is too late. Okay, so we use the sensor data, right, from your devices, and we analyze how and what children focus, switch tasks, interact. So that's why we focus on attention changes. The attention changes, in everyday life are first signals, mental health decline. It indicates your interest change, your ADHD issues, mental health issues, even, learning issues. But the, attention signals is too subtle. That's why we built this kind of a technology. We named it as Dr. Simon, as homage of my grand advisor. So Dr. Simon analyzes, eye tracking data, your voice data, typing rhythm, and touch and stylus patterns to detect these subtle but meaningful behavioral changes. Okay, so we have some publications about our approaches. Also, we just finished a clinical validation with the university hospital. And one of my favorite papers we published in psychological medicine, it shows your stylus pen use. So while you're writing with your stylus pen, it indicates your depressive symptoms. Okay? So basically, we try to catch kind of mental health decline signals as early as possible in everyday life. We complied with the GDPR. It's almost done. It took really, really long time. And based on Dr. Simon, we are trying to make a kind of a mental health ecosystem across the schools, homes, and clinics. We already kind of launched the service, Dr. Simon service for schools. It's called the Focus Pang. So it detects you can. So this is a real situation. So this video was taped about 3 years ago, or almost 4 years ago, by Seoul Metropolitan Office of Education. So the kids, students and teachers use our services. Okay, it's a real service, real classroom. And then while they use the tablets, they analyze the sensor data in the background of their, tablets. And then we generate reports about their learning at the same time about their kind of attention and mental health kind of signals. Yeah. This is quite a different from traditional healthcare approaches because we focus on young people and most of them are in schools. We go to school and we measure, we assess them, and we help them. Kind of a school-based mental health care program we are building. So one of the examples that
Please.
educators love is this kind of graph. So it shows kind of real-time live engagement, whole class, minute by minute. So that the teachers can understand the kind of the whole classroom level, attention, and they can kind of a change. They can improve their teaching tactics. Okay. So this is the way of kind of people accept our technology instead of arguing. I would say, great, you accept it, you buy it. Okay? We this year we are serving about 500 thousand users across the 1,200 institutions. We made about last year we made about 2 million US dollars as revenue, and this year we expect about 3 million. And we are launching, this month, we're going to launch a new service based on Dr. Simon technology for families. So basically, this technology use, the private uh, devices like, personal smartphone, personal, computers, a MacBook, not just, not out, not the school computers. Okay? Home computers. That's the project. So we generate this kind of report for parents, so that parents can understand their children's interest, how they respond to with the stimuli and the smartphone, and so what kind of experience they're having. Okay, so that the parents can understand when they give praise, when they give encouragement. And also we
Yeah,
just
since
finished
we are
kind of
running out of
validation.
time, could you please wind up in 30 seconds, please?
Okay, so this is the same thing. We do things for clinicians. This is a clinicians report, weekly report, so that they could get objective data from their patients' everyday life. Okay, and we generate these kind of things from the patient devices. So we are kind of, we're from Seoul National University. We consult parents, but, from cognitive science, real-time AI to digital psychiatry. But we're not just in the technologists. We are parents. That's why we focus on youth mental health care. Thank you.